Hello and welcome to the news at 10 here on NTA News 24. We are reaching you live from the network service of NTA in Abuja. I am Claire Adilabu Abdulrazak.
Thanks for joining us on the news at this hour. Let's begin with the headlines. I'm Comfort Amadou.
President Buhari confers with Pakistani Prime Minister on global initiative on debt relief to mitigate effects of COVID-19.
Nigerian Center for Disease Control confirms 3,526 coronavirus new cases in the country.
Presidential Task Force on COVID-19 tasked state governments on security of coronavirus patients to prevent cases of restiveness.
We urge all state governments to continue to pay attention to the welfare of people in isolation and for security agencies to provide adequate security around such facilities to prevent escape.
And Kano State Government discharges 16 more COVID-19 patients from its facilities after testing negative for the virus. Many thanks for staying tuned with us on the news. Now, the Nigerian Center for Disease Control and CDC has announced 381 new cases of COVID-19 in Nigeria, increasing the number of confirmed cases to 3,526 till date. Of the 381 new cases, 183 are in Lagos, 53 in Kano, 55 in Kano, 44 in Jigawa, 19 each in Zamfara and Bauchi State, while 11 is in Katsina, 9 in Borno, 8 in Kwara, 7 in Kaduna, 6 in Gombe, 5 in Ogun, 4 in Sokoto, 3 each in Oyo and Rivers, while 2 is in Niger and 1 each in Akwa Ibom, Enugu and Plateau States. Now, Lagos State has a total of 1,491 cases, followed by Kano with 482, while FCT has 316 cases confirmed. And currently, 601 patients have been discharged with 107 deaths recorded.
And from Kano State Government has discharged 16 more COVID-19 patients from its facilities after they tested negative for the virus. A statement signed by the Commissioner for Information, Malam Mohammed Garba, indicate that this brings the total number of discharged patients in the state to 22. He said among the discharged patients were Professor Abdulrazak Garba Habib of the Department of Medicine, Aminu Kano Teaching Hospital, Bayero University, Kano, who is also the co-chair State Task Force on COVID-19. Dr. Amina Ibrahim Sanyawa, the State Commissioner for Health, among others. The Commissioner pointed out that all the patients have tested negative for the disease after the 2 follow-up tests and have therefore reached full recovery. He advised the public to continue to observe the strict personal hygiene through regular hand washing, use of face masks and social distancing. And meanwhile, the Kogi State Government has directed that the NCDC COVID-19 response team currently in the state to assist and verify its COVID-19 free status be isolated at the state quarantine center for 14 days in line with laid down procedure. Governor Yaya Bello gave the directive while playing host to the NCDC members shortly after their arrival in Lokoja. Francis Udojo will bring us details in our upcoming news. And state governments have been urged to take welfare and security of COVID-19 patients seriously in order to prevent cases of escape and restiveness. Chairman of the Task Force and Secretary to the Government of the Federation, Boss Mustafa, said this at the daily briefing in Abuja. Here is Mutari Igben with the rest of the story.
From various
breaches of basic guidelines to contain the spread of coronavirus among Nigerians remain on the front burner.
Increasing level of abuse of exemption granted to vehicles conveying specific goods. Reports across the country show that They continue to hide passengers with the intention of ferrying them across state boundaries. Continual transportation of the Almajiris across state borders is still evident. We implore all Nigerians to alert the security agencies whenever they witness the violation of these guidelines.
Every business should invest a little bit in hand-washing facilities and sanitizers.
With recent reports of protests in some isolation camps, the PTF called for greater vigilance.
We urge all state governments to continue to pay attention to the welfare of people in isolation and for security agencies to provide adequate security around such facilities to prevent escape.
On the 14-day compulsory isolation for the first batch of Nigerian returnees in the country, the Minister of Health says
they will be tested, and any person tested positive shall be transferred to a treatment center.
We are hoping to have another flight coming in from the UK. They'll be landing in Lagos first, that's the plan, and then we'll be ferried to Abuja.
The task force frowned at reports of continued harassment and denial of access to journalists as essential workers during curfew hours.
The issue of harassment of journalists, yes, we are having a meeting of the security chiefs tomorrow. I have already reached out to the IG, and I'll try and see if we can get him so that before the meeting he's aware of the issues and he'll be able to intervene.
I promised that I was going to contact the Lagos State Commissioner of Police. I took up the issue of the harassment with him. He recognizes the fact that journalists are on essential duties and that every support will be given to them in the course of their duties.
Meanwhile, the Federal Ministry of Health has stepped up training of health workers in the country to stem the risk of infection among medical personnel caring for coronavirus patients. In Abuja, Mitaire Ikben, NTA News.
The United Nations Women has donated more than 38 million naira to the Federal Ministry of Women Affairs as support for Nigerian women who was hit by the effects of the lockdown. Momso Damien Detti has the report.
The Ministry of Women Affairs is opening its gates after the long compulsory lockdown break. Activities are gradually picking up, and the first callers to the ministry are the United Nations women.
No longer in the shadow, cause to stay behind.
Open gates later led to wide smiles as they did not come empty-handed, but with some monetary support for Nigerian women who was hit by the effects of the lockdown.
Frontline services in Lagos, for example, have reported a 300% increase in gender-based violence cases from March to April. So in view of some of these challenges being faced by women, UN Women is very happy to be collaborating with the Ministry of Women's Affairs as part of its humanitarian response. Hope that the support will meet the immediate needs of up to 12,600 vulnerable women and girls by improving their food security and their access to hygiene.
The Minister of Women Affairs, Paul Talon, is appreciative of the gesture, promising equitable distribution among women across the 36 states.
We continue to appreciate and work together to see that Nigerian women are well cared for. These palliatives and whatever we're reaching out to, the poorest of the poor, those who live on daily business to earn their living.
38,453,660 naira is the support received. In Abuja, Momso Damien Ati, NTA News.
All right, and the Federal Capital Territory Administration has also provided palliative items to Nigerian Union of Journalists, NUJ, Nigerian Association of Women Journalists, NAWOJ, and civil society organizations as part of measures to cushion the effect of the sit-at-home order.
Ifeanyi Ezumba reports that the FCT Minister of State, Ramat Tijani Ali, presented 200 bags of palliatives to NUJ, 100 to Nawaj, and 500 bags of rice to National Association of Nigerian Students.
Appreciating NUJ, NAWOJ, and civil society organization by extending hand of fellowship, FCT Minister of State Ramatu Tijani Aliu thanked them for always practicing and propagating COVID-19 preventive measures and ensuring that vulnerable society is served.
None of you have also traded in anything. Situations made people vulnerable. So while identifying the very vulnerable ones, we identify our own frontline officers that have served diligently, whose families at home also sitting at home.
Chairman NUJ Ima Uweche commending FCT administration for considering the sacrifice journalists make in reporting COVID-19 issues, emphasized the need for media workers to be paid hazard allowance.
It has been our position that journalists and media workers generally are deserving of palliative as well as payment of hazard allowance. The FCT administration, through the Minister of State, Dr. Ramatu Tijani Aliu, has demonstrated words with action.
She recognized that their importance, and the Minister also, Mala Mohammed Musa, both of them agree that it's very important to carry these critical stakeholders along. That's why they reached out to the leadership of NUJ, state as correspondent, and the women journalists, so that they will come and be part of the palliative.
You had a good plan, and you put us through all the process. There was no hidden agenda.
For a woman for her kind to come up with the passion of the poor man in the streets, I think she deserves kudos to this. And also, this is just, moreover, we should remember this is the first palliative item shared. We are expecting the second rank.
The Civil Society Organization and Nigerian Union of Journalists endorsed the Federal Capital Territory Administration for transparency during the process of distribution of palliative in the FCT. In Abuja, Ifeanyi Ezugbo, NTA News.
All right, let's take you to the Niger Bridge in Anambra State, where the interstate border closure measure by the government to stem the spread of coronavirus is riddled with challenges at the boundary. Kevin Ubeche was at the Niger Bridge and now gives us a situation report.
Traffic mounts at both ends of the bridge, with drivers of heavy-duty and other vehicles trying to gain entrance into Delta or Anambra states through the bridge amidst checkpoints.
They block all the time because of too much gathering. So they block Delta so that there will not be hold up on the bridge. This bridge is very weak now.
I entered the hold up after 5:30 yesterday evening.
Been in this go-slow for more than 4 hours. To come into the bridge, 4 hours.
Why?
Because of the hold up.
Many passengers are forced to walk the length of the Niger Bridge before boarding intrastate vehicles.
You have to use your leg. And walking down from that place to cover up this head bridge is something else.
Motorcyclists and tricyclists make brisk businesses ferrying passengers across the Niger Bridge. John Waka says he makes up to 10,000 naira daily.
As this thing been, anybody will go out without 10,000, I will not say machine no good.
To avoid overcrowding of the bridge by pedestrians, security operatives force them to use the walkway.
They are not complying anything because it's not what we expected. Because what the weight of the people, the human being is more than the motor now.
However, with this situation, it seems the interstate border closure enforcement is not yielding the desired results. In Asaba, Kelvin Wechi, NTA News.
Obviously, Claire, with the crowd, it looks like there's no social distancing at all. Like they're not aware of coronavirus in the state.
It's not like it looks like there was obviously no observance of social distancing, which is not good for us at this time, and which is one of the reasons why the PTA COVID-19 task force is insisting or is warning that there might be another round of lockdown, so that
with the crowd there, they can easily contact them because you don't know who has it.
Precisely, and that's the bridgehead in Onitsha. That's not good enough. I think they should do much more than that.
All right, a mobile court set up to try defaulters of the lockdown directive of the Niger State government in Mina, the Niger State, the state capital rather, has convicted 76 persons.
Now, Dauda Mohammed reports that those convicted include 40 persons apprehended in a vehicle from Kano en route to Lagos.
The lockdown directive put in place by the Niger State government to curtail the spread of COVID-19 has been having various levels of compliance, with some days being effective while other days witnessing a high number of defaulters.
We are presently at the Kwakungu roundabout, one of the major exit and entry points into Minna, the Niger State capital. And today is a lockdown day, but there are motorists on the road, most of them claiming to have passes for being on the road, while others have been told to park so that investigation will be carried out on why they have to be on the road on this lockdown day.
Food to my family. That is why yesterday was a free day for you. But I was not around yesterday now, for goodness sake, sir. My major problem is that in Minna, every business, somebody has a pass.
One of the defaulters arrested is this articulated truck from Kanu en route to Lagos with 40 passengers, including 2 aged women and a minor. After their arraignment, they were all convicted for violating the interstate movement order and ordered to pay fines. The driver was charged 10,000 naira or 1 year in prison. Other defaulters were also charged and fined.
We broke the law. We are seeking for pardon.
We tried the convicts and we punished them under Section 19 of Public Amended Law.
We can quarantine them back to Sender where they are coming from. They will go back.
Niger State shares boundaries with 5 states and the FCT, making it a transit state for travelers from the south to the north. In Minna, Dauda Mohammed, NTA News.
All right, it's quite obvious that a lot more awareness, and sensitization needs to be done.
Yeah, because it looks like they're not aware of the social distancing rule across the states.
Exactly, and of course the interstate lockdown. You're watching the news at 10 on the network service of the NTA. We'll take a short break. We have more news coming up.
President Buhari confers with Pakistan Prime Minister on global initiative on debt relief to mitigate effects of COVID-19. Details shortly.
According to online community policing platform Check My People, they say police don't catch the house girl we carry in Madam Children run.
Want to be sure your staff is who they say they are? Let's Check My People help you with background checks. First, enroll your current domestic staff at www.checkmypeople.com using their NIN. Verify them on Check My People against the national database at NIMC to ensure they are who they say they are. If you get domestic staff from an agency, register that agency on checkmypeople.com. Document your experience with the agency and staff. Rate them on our system so others can see their track record. If you are seeking a new domestic help, verify their NIN first at Check My People. Then use their NIN to search our database to see if they have a work history, if they have committed crimes elsewhere. Wouldn't it be good to know? Remember, most crimes are committed by repeat offenders. Do your due diligence. Check My People. Trust, but verify.
Welcome back. You're watching the news at 10 here on NTA News 24. Now, the 5-man committee constituted by Jigawa State Government to investigate causes of mysterious death in Hadijia local government area of the state has discovered that the deaths had no links with COVID-19. Now, the committee, which traced 90 new graves in all cemeteries, says it adopted standard procedures to arrive at its findings. Well, to give us more light into this, we have Dr. Abba Zakar Umar, Commissioner for Health, Jigawa State, joining us via Skype. Honorable Commissioner, we thank you for joining us from Dutse.
Thank you very much. Yes. Yes, like you rightly said, we received a report from the... there is a spike in death in that town. So the government immediately set up a committee headed by a public health physician, including also a representative of the World Health Organization, to go and look at what is happening in Hadijia. And they looked at the hospital data, they visited the cemetery, and they interviewed individuals that were affected. And they triangulated all this data. And at the end of the day, they found out that there is actually no significant difference in the death rate in that particular town. And most of the people that actually died were elderly who also had some comorbid condition. but there is a particular one individual that died that they could not ascertain whether it is COVID-19 related. But in summary, the conclusion of the report is the deaths are not COVID-19 related, and as earlier reported, it was within 4 days. It wasn't within 4 days. The time period was really more than that. But despite that, we are still working very closely with our team in Hadejia, and we've also intensified surveillance in that town. To ensure that things don't change drastically after this investigation.
All right, Commissioner. Obviously, cases of COVID-19 keeps rising in Jigawa State. One will wonder what is the level of awareness in that area and routine hygiene practice.
Well, to be very honest with you, why the cases are rising is really very, very simple. We had about 600 Almajiris that were repatriated from Kano. Before they were repatriated to our state, they had mixed in Kano for some few days, and they were transported in same vehicles to Jigawa State. So what we decided was to ensure that we quarantine these Almajiris for 15 days, and we set up a medical team to be examining them from. Just before 14 days, we decided to test all of them. So we took the sample of 600 of them, and as at yesterday, a report of 148. Result of 148 out of the 600 is out, and out of that, about 40 are positive, which is showing you that about almost 30%. Infection rate among those 600 Almajiris. So this is the reason why the numbers have spiked, and they will even get worse, because only the result, like I have said, only result of about 145, 148 is out. There are still more than 400 to come out. But the good thing is, since they entered Jigawa, we actually isolated them, so they don't have any contacts apart from themselves. So those that are infected now, we move them to isolation center, and we are expecting some more results today and in the coming few days.
Dr. Umar, I'd just like to take you back to your earlier comment. You've ruled out COVID-19, related issues with the number of deaths recorded so far. But what other comorbidities did you find out, could be responsible for those deaths? Well, we do apologize. Okay.
Some are hypertensive, some are diabetic, and some also have other chronic diseases already. So these are the combined issues that actually increase that morbidity and mortality around that area.
Okay, let's quickly look at the lockdown of local governments just to reduce the community spread. How effective has this been?
Well, I think a lot of things have been done. A lot of interventions are being put in place in Jigawa to ensure that the community intervention is working. Number one, over here we have a practice of once a week there is a market day where people gather from all over the state as well as from neighboring states to come and to a particular market and buy and sell, and that we felt is an avenue that will increase transmission of COVID-19. So that has been suspended for now until further notice. That is number one. Number two, gatherings in terms of wedding, what the government had directed is for the past 1 month now, if there is going to be a wedding, the bridegroom will bring 3 people and the groom will also bring 3, and then the imam making a total of 7, and there are no wedding ceremony. So also there is no after funeral, people disperse, they don't stay, to take condolence. And then also, like you are aware, we've closed all our schools, both primary, secondary, and tertiary, as well as Sangaya schools. And we've also prohibited any other gathering that is for more than 5 people. And then aside that, also of recent, we've made the use of face mask in public mandatory. So, and aside that, also a lot of community awareness is happening in the radios, in the television. There are a lot of funding programs. We've involved the religious leaders, the traditional institutions. Our emirs have been on air for several months, talking to the public and creating awareness to our religious leaders. So, with the combination of all these things, we felt our community mobilization and awareness strategy is working. But our biggest problem is the almajiris that we have. And currently, aside the 600 almajiris that we got from Kano, Gombe State Government repatriated about 69. Nasarawa State Government also repatriated 393. Kaduna additional 31. So we have over 1,000 almajiris now that are currently under quarantine. And we feel that this is really, really a big challenge for the state. But the good thing, like I have said, they are isolated. They are not mixing with the community, and they don't have any contact within the community.
All right, Dr. Abba Zakari Umar, Commissioner for Health, joining us via Skype from Dose. Thank you very much for your time.
Thank you very much.
All right, you're watching the news at 10 here on the network service of the NTA. We're taking another short break. When we come back, we have more news. Where are we going to?
In times like this, the coronavirus is spreading.
Guidelines for eased lockdown, as announced by the Presidential Task Force on COVID-19, are effective from 4th May 2020 in Abuja, Lagos, and Ogun states. For public spaces, the following are mandatory: improvised face masks, temperature checks, hand washing facilities and hand sanitizers, physical distance of at least 2 meters, no sporting activities and mass gathering. On travel, these are prohibited: passenger flights, interstate travel except essential services, movement of agro products and petroleum products. Note, there will be mandatory supervised isolation of returnees for at least 14 days. For markets and offices, neighborhood markets are to open 3 times a week from the hours of 8 a.m. to 3 p.m. Banks and financial services are to open from 8 a.m. to 2 p.m. Government offices are open only to staff from grade level 14 to 17 between the hours of 8 a.m. and 2 p.m. on Mondays, Wednesdays, and Fridays. Corporate offices and private sector are open to business from 8 a.m. to 2 p.m. Schools, churches, mosques, clubs, bars and gardens remain closed till further notice. COVID-19 is real. Take responsibility and stay safe.
Coronavirus is real. Steps to avoid this pandemic. Wash your hands regularly or sanitize your hands. Keep social and physical distancing. Avoid crowded places. Stay at home unless absolutely necessary. Don't touch your eyes, nose, or mouth if your hands are not clean. Avoid the spread of coronavirus. Coronavirus is real.
This is the network service of the NTA.